So cruciate disease or cruciate ligament ruptures are one of the more common orthopaedic injuries that we see in dogs. And the cruciate ligaments are the main ligaments supporting the knee, and basically these ligaments in here, they're called cruciate because they basically cross over. And we tend to refer them as the cranial and caudal cruciate ligaments based on where they insert on the tibia, the lower bone here. Now, cruciate ligament ruptures in dogs are quite different to in people. In people, it very much tends to be a traumatic injury, so it's running around on the footy field, having an awkward slip or twist, skiing, those sort of injuries. That's the classic sort of cruciate ligament injury. In dogs, it tends to be a degenerative condition, so it's not actually an acute trauma that causes the rupture in most cases. We do see it occasionally as a traumatic rupture, but what happens more often than not is there's a weakness within the ligament, and the ligament actually ruptures in normal activity. So it may be the dog jumps up on something or jumps down from something and ruptures it. It may be that it's going for a run or sometimes even just going for a walk. And basically what the cruciate ligament does is it stops the backwards and forwards movement in the knee. So cruciate ligaments, like I say, live in the knee there. And when the cruciate ligaments are ruptured, we get this sort of movement. So with people, it's not quite as dramatic initially because our legs are quite straight. And so as people walk, the force is downwards. With dogs, because of the shape of the dog's leg, the biomechanics basically mean that with every step with a ruptured cranial cruciate ligament, the knee moves forward like this. And that's why it's quite important in larger dogs in particular that we want to be stabilising these joints, because that constant movement damages the cartilage in the joint and makes things a lot worse. Like I say, most times it's a degenerative condition. Sometimes we have underlying causes, so a condition called medial patellar luxation where the kneecap doesn't sit in the joint properly, that can predispose to rupture as well because it's not helping support the knee. Now, when it comes to treatment of these conditions, there's two main groups of surgeries. One is basically putting in a prosthetic ligament, and that's the most common procedure that we perform. So basically what the prosthetic ligament does is it connects through the tibia here and around the back of the femur. There's a few variations on the theme, but basically what that's designed to do is to mimic the action of the cruciate ligament and help stabilise the knee. So as part of that procedure, we'll quite often go in, clean out any damaged cartilage, clean out any ligament that's sort of dangling there and loose, but that's the main part of it. The other type of procedure basically changes the biomechanics of the knee, and that can be a tibial levelling surgery, or there's a few variations of that. And what that procedure basically does is it changes the biomechanics. So instead of every step getting this action, the biomechanics are changed so that the tibia is pushing up into the base of the femur, and so we're not getting that forwards movement. So if the animal's relaxed and we actually manually move the knee, we can still get that movement, but like I say, the biomechanics of actually walking are changed. And different dogs have different kind of needs for the surgery, so particularly the large breed dogs will probably benefit more from a tibial levelling surgery, whereas the smaller dogs do very, very, very well with an extracapsular repair. Now, when it comes to whether the dogs need surgery, we do look at a few things. Certainly the size of the dog is quite important, so large breed dogs have a lot more problems if we don't do surgery, whereas very small dogs, so the 5 kilo chihuahuas, will generally actually do quite well with conservative management, but once again, it's a case by case sort of balance. We also look at the age of the dog, because if it's a dog that's 5 years old, obviously we're going to get a lot more degeneration in the joint if we don't deal with the rupture compared to a 13-year-old dog. So a 13-year-old dog the joint will eventually stabilise itself to a large extent, and the long-term arthritic development is not going to be as severe. So yeah, that's something we do take into account, and if your dog has a cruciate rupture, they're the sort of things that we would consider. But yeah, like I say, it's a degenerative condition in dogs, so generally not associated with trauma. You'll find your dog just is suddenly lame with no reason. The other thing that's quite relevant to it being a degenerative condition is we have a weakness in the cruciate ligament, which means that around 50 to 70% of dogs that rupture one leg will go on to rupture the other. And so if your dog does rupture a cruciate ligament, you want to be dealing with it as quickly as possible, so it's using that leg as quickly as possible, and that puts less strain on the other leg, so you're less likely to end up in the same situation. But even with quick management, there is still that chance that the other leg is going to be affected as well. So yeah, that's the basics of cruciate ligament injuries.